Picture this: a network of nerves extending from the spine and branching out to give life to each arm. This intricate marvel of nature is known as the brachial plexus. But what happens when this network faces injury? The result could be a condition known as Erb's palsy. Erb's palsy is a paralysis or weakness of the arm that occurs when the nerves of the upper brachial plexus are injured. These nerves give movement and feeling to the arm, hand, and fingers. When they are damaged, it can lead to a range of complications from mild dysfunction to total paralysis of the arm. But how does this injury occur in the first place? The most common cause is birth injury, specifically during a difficult or obstructed labor. The baby's shoulder may become impacted against the mother's pelvic bone, causing the brachial plexus nerves to stretch or tear. However, it's not exclusive to newborns. Trauma from accidents, gunshot wounds, or surgical complications can also lead to Erb's palsy in adults. Risk factors, on the other hand, are elements that increase the likelihood of Erb's palsy. In terms of childbirth, these could include a large baby, a breech position, or prolonged labor. In adults, high-risk activities or occupations that increase the chance of traumatic injury can be considered risk factors. Medical professionals use a variety of techniques to diagnose Erb's palsy. These may range from physical examinations and nerve conduction tests to more advanced imaging techniques like MRI or ultrasound. The treatment, however, is largely dependent on the severity of the nerve injury. Mild cases often recover with physical therapy, while severe cases might require surgical intervention. It's also worth noting that Erb's palsy is not always a life sentence. Many patients regain function in their arms with proper treatment and therapy. However, in some cases, the damage may be permanent. So, to recap, Erb's palsy is a condition characterized by arm weakness or paralysis, often resulting from injury to the brachial plexus. The most common cause is birth trauma, but it can also occur in adults due to accidents or surgical complications. Risk factors vary from childbirth conditions to high-risk activities in adults. Diagnosis involves a range of techniques, while treatment depends on the severity of the injury. Recovery is possible, but in some instances the damage may be irreversible. Erb's palsy, while a potentially serious condition, highlights the incredible complexity and resilience of the human body. It serves as a reminder of the delicate balance our bodies maintain, and the extraordinary efforts of medical professionals to restore that balance when it's disrupted.